This placement was conducted at Bendigo Health's Community Health Service. Bendigo is a vibrant city located 150 kilometres from Melbourne. My placement partner Rachel and I genuinely had a great time getting to know the city's goldmine, galleries, gardens, markets, talking tram and obviously the good coffee. Bendigo Health is a healthcare provider in regional Victoria, servicing the Loddon Mallee region. There are a total of 16 dietitians providing services in acute, rehab and community-based settings including mental health services and residential services. The Community Health Service receives various sources of funding to support their provision of services to people with disabilities and elderly people living at home. The inter-organisational partnerships providing this funding include the National Disability Insurance Scheme, Commonwealth Home Support Program, HACK for Young People, Murray Primary Health Network funding, and local area health service funding for surrounding towns. The community dietitians spend time doing home visits, projects for quality improvement, ongoing professional development, outpatient rehab clinics, group activities for health promotion and education, outreach to local schools, and chronic illness support groups. The aim of our project was to increase the availability of suitable visual resources for Bendigo Health dietitians to use when supporting clients with intellectual disability and autism spectrum disorder. Our project touched on the needs assessment, planning, implementation and evaluation aspects of the project management cycle, but mostly fit under the planning phase. Prior to project beginnings, the dietitians had already established the need for improved visual resources to use in consultation with clients with disabilities. The dietitians sought quality improvement in 3 primary areas: visual recipe resources, paediatric activities, and a communication aid in the form of a talking mat. We conducted a literature review to support the dietitians' express need and to determine the specific needs of people with these disabilities. The planning phase heavily involved the key stakeholders including Bendigo Health dietitians and recipients of the resources. Firstly, we conducted a survey on Bendigo Health dietitians to assess their satisfaction with the resources currently available and incorporate their feedback and suggestions into the development of the new resources. One client with disability was informally interviewed during a home visit. This influenced our choices in format, images and wording. With the information gathered, 3 targeted resources were able to be developed: the visual recipe template, the paediatric activities and the talking mat. The paediatric activities were then trialled on 3 young children. Feedback gained from this allowed the resource to be adapted and made more suitable. The final stage of planning involved meeting with the Nutrition Resource Working Party, comprised of Bendigo Health dietitians, where the resources were presented and discussed. The dietitians gave feedback, identified elements they liked and areas for improvement, and questioned how the resources would operate in practice. Implementing the resources was not possible to achieve within the 5-week timeframe, so we constructed a comprehensive set of guidelines for the dietitians in order to facilitate a smooth transition into using the resources independently. The guidelines were a thorough description of each resource, including recommendations on how dietitians may use them in practice upon the completion of the student project. A PowerPoint presentation was also delivered to the dietitians, and several role plays were also performed to demonstrate the various ways the resources could be implemented and adapted to suit the client. Formative evaluation was conducted initially to develop a greater understanding of the express needs. Process evaluation was interwoven throughout the entire planning and production phase to ensure that the resources were progressing as planned. Feedback was continually sought from key stakeholders, primarily the dietitians, to assess their satisfaction with the resources and determine whether they will be effective in practice. Conducting impact and outcome evaluation to assess longer-term effectiveness could not take place due to the project's time constraints. So a plan for future evaluation was made and a series of suggested evaluation questions for both dietitians and clients were formulated. In the needs assessment and planning phases, we took into account the social determinants of health in order to create targeted, relevant and appropriate resources. In the needs assessment, we examined the literature surrounding people with intellectual disabilities and autism spectrum disorder and identified the social determinants which would have the greatest impact on this population group. These included education, income and access to healthcare. The determinant we could have the greatest impact on through this project was education, specifically health literacy. This was central in the planning phase during the development of resources, which were tailored to the appropriate education needs. During the implementation phase, we adopted adult learning theory, or andragogy, in teaching the dietitians how to effectively use our resources. The information provided was relevant and practical. The PowerPoint and role plays identified the gaps in current practice and clearly demonstrated how the resources would improve this and bring benefit to them and their patients. This also involved communication theory. Our speech, role plays, PowerPoint slides and handouts were all various forms of communication which we adopted to assist the audience or dietitians in understanding our message.